Welcome to the next episode of our Breakthrough Autism podcast. I'm thrilled to have with me today Emily, Registered Behavior Technician or RBT, who will share her experiences and learnings from working with children with autism over the past couple of years. Welcome, Emily.
Yeah, thanks for having me.
Thank you. Thrilled to have you here. So, Emily, you started off as an RBT or Registered Behavior Technician and learned, even actually prior to that, got your certification as an RBT, worked front line, and then moved your way up into a supervisory role. So we'll talk about that today and share, how you got there and also some of your learnings from this experience. So to start with, what brought you into the field of autism? Why work in this field?
Great question. So, growing up, I had a neighbor that had autism, and that was my very first exposure to what is autism, what is ASD, what does this mean? And my neighbor was kind of he was like more of a, what do you call, like a typical case of autism. Like, he didn't talk, he was slower to learn some things, but that was the only exposure that I had known and my family had known growing up. And it was definitely interesting for us to see how, when my sister and I were growing and we were learning things and like retaining skills that he wasn't able to hit those same milestones. And that really was what got me into the field and got me started. I was like, this is interesting. Like, I want to be able to help him. I want to be able, I want to be a part of his life and to help him do the things that my sister and I were able to do. And so I think I was in elementary school still, but I started not babysitting. I don't like to call it babysitting, but just started like hanging out with him, just watching him when his parents needed to leave because they couldn't leave him home alone, right? And it's challenging to have a kid that you can't leave home alone when, he was older than my sister and I. And so we started just hanging out, working together, and it slowly became like, oh, I wonder if I could just, help him like eat on his own or help him get dressed or help him do all those basic skills. And they had SLPs and OTs and different people come in, and I would work alongside them, and I was always interested in what they did. But I never really knew like how to teach, right? So then I went to school, which I'm sure we'll talk a lot about, but
Yes.
I went to school, and that was my first exposure to ABA. And I thought, this is incredible. This is amazing. I want to do this like as a career. So
Incredible.
then here comes Breakthrough. And I applied and I started as an instructor, and here I am now. So
Amazing.
Yeah.
That's an amazing, journey to get to that point, to be this young girl seeing a neighbor who had some challenges navigating his world. And for you to think, this is amazing for you to think, I think he can learn, like he can be empowered with some skills to, live his best life. That's pretty remarkable for a young Emily to be thinking about, because for me, thinking about my career, what I was at the stage too, where we were at the stage where we were able to impact change for individuals on the spectrum, which is amazing. But I remember learning in school, and this really deeply affected me, was that it wasn't too long before I started my schooling, maybe a decade or two prior, that there was a prevailing belief that individuals on the spectrum could not learn, actually, that this was the prevailing belief in society. And it took actually some incredible pioneers in behavior analysis to show that no, actually, society is wrong. Individuals on the spectrum can learn. And not only can they learn, but we can change their developmental trajectory. This is remarkable. So for young Emily to have that thought with the neighbor that we can do better is really impressive, really, to be honest, because most people, wouldn't be thinking along those lines. So then you had that to the full circle moment of going to school to figure out how to teach individuals like your neighbor, really, which is amazing. So you go to school and you discover this thing called ABA. So for people that might be watching that don't know what ABA is, or applied behavior analysis, in your experience, we don't need a technical definition here, but like, what is ABA to you?
To me, it is the way of teaching people. And Honestly, I think everybody should use it. I did a lot of like, I did research in school,
Mhm.
and in my research, I used ABA in exercise. And it's been used to teach, like, obviously children with autism or any individual, but it's been used so many different ways, and that's what I love about it is you can really apply it to anything. And it's to me, it really is just this way of teaching that, like, it makes things stick. It really helps you learn. Like, it's repetitive, but it helps you learn, and it really is something special, I think, for so many people.
Amazing. Yeah, it's so good that you said that actually, because a lot of people associate ABA with like sort of a specialized form of teaching for autism, for
Mhm.
example. And yes, it is this science has done remarkable things for
Mhm.
individuals on the spectrum. But really what it boils down to, what ABA is it's really it's learning, it's teaching, it's the ability to change the environment in some
Mhm.
ways so that people can learn, whether it's
Mhm.
individuals on the spectrum, whether it's exercise, whatever it is, it's really empowering
Yeah.
because it's about figuring out how to teach people all sorts of things,
Mhm.
right? And it's optimistic too. I think when I
Yes.
when you share what you shared that you can impact so many
Mhm.
different people in a community through ABA,
Yeah.
it's an incredibly optimistic way of looking at life because it's just like, well, people can learn.
Yes.
And we think of that because we're in the field like it's something so
Mhm.
basic and obvious, but to a lot of people in society, it's not because we
Mhm.
hear, even with kids on the spectrum, that, sometimes there's just, well, they just can't do that. Or, they're not ready to learn. That's one of my favorite, quote unquote, favorites that I hear because I'm
Yeah.
like, that's not true.
Yeah.
And then the reason why it's one of my favorites is because people like you then move on to showing that in fact it isn't true,
Mhm.
that we have individuals that yes, they may have certain needs that require their learning to look different,
Mhm.
but they can learn.
They can.
That's it. That's what
Yeah.
ABA is. It's
And
about
sometimes it
learning.
might take something different, right? And I think that's probably one of my favorite parts is, if you teach a kid something one way and you try and teach the next kid the same thing that same way, it might not work,
Yeah.
right? You
Yes.
might have to find something completely different. But that's what I love is when you find something that clicks for that child, it's the best feeling and the best
Mhm.
moment. And it makes such a big difference in their life, in their family's life, in their community's life. And I think it's so special to really to be a part of that and to make this impact
Yeah.
on so many people's lives. Yeah.
Absolutely. Yeah, I love that too. When you figure it out,
Yep.
it's like this accomplishment because we're optimistic
Mhm.
and we believe that every child can learn.
Yes.
And so then it's just like, you know what? We just got to figure out what it's going to look like for
Mhm.
this child. We need to figure out what environmental arrangements
Yep.
are going to impact that child. So we have that belief. Now, you might have to really work lots of different angles. Like you said,
Yes.
what works for one child, unlikely to work for the child, right beside them.
Mhm.
But we know it's possible. And then when
Yes.
you figure it out, you're like, yes,
Yes.
it's a game changer
It
for
is.
them, for their family, for the community. So
Absolutely.
that's it. That's the hook for us, right?
Yep.
It's seeing people who are capable of learning and not having their learning needs be
Mhm.
met, and then being able to meet those needs and know that that's going to impact their life. For anybody who's watching, who's wondering about a fulfilling career, this is it.
This is it.
This is it.
It is very fulfilling.
Yeah.
Yes.
So you went, and then so much so
Mhm.
that you went to school for this. Tell
Mhm.
us a little bit, like you put in an investment into
Yes.
figuring this out. So you
Mhm.
were intrigued to say, I can help people like my neighbor do
Yep.
better. You go to school for this
Mhm.
path. Tell us about your schooling.
So, yeah, I went to Seneca College and I did the behavioral psychology degree there. And
Mhm,
it, well, a lot of people didn't know it going into it, but it did specialize in ABA. And
mhm,
we learned like the principles very early on. We learned about like graphing and data collection and different strategies to teach and about reinforcement and punishment and just everything to the point where I really wanted to know more. Like it was good to hear about it. I was like, "Okay, yeah, thanks for telling me this information." But I was like, "I need to do it. Like I need to use these strategies and use these techniques and like really make an impact," which is why I did apply to breakthrough. And then
mhm.
after when I was doing so I did both for a long time. I worked and did school and I found it very helpful. And it actually
Yes.
made school easier because I would go to work and do something, and then I would go back to school and be like, "Oh, I remember when I taught a kid how to do this." Or I remember when I reinforced them using this and this and this. And I could really tell that they like meshed well.
Wow.
And it really helped my learning so that I was able to complete assignments with actual knowledge and not just, well, I know what the textbook definition of X, Y, and Z is, but I actually did understand like deep down what the procedures were and the impact that they were making on people's lives.
Yeah.
So I found that like to be really special. So yeah, that was
Amazing. Not easy though. Like,
not easy,
that
but the balance between the two.
balance, yeah, yeah, of the two. But your experiences are that to be able to hear it in school and then
Mhm.
to apply it in like
Yeah.
real life, right? Like
Mhm.
those, especially, what we're in the name of the game of is all the
Mhm.
positive reinforcement based procedures and
Yeah.
all that kind of stuff. But it's, different to hear, okay, or, break things down into small steps. We call
Yeah.
it task analysis.
Yeah.
That's our fancy term for that. But to break something down and figure out what are the appropriate teaching steps, figure
Yeah.
out what the strategies are,
Mhm.
figure out what reinforcement really means, which is
Mhm.
essentially, sometimes I like to call it the party. Everyone, we all
Mhm.
like our own parties, right? That are
Yeah.
specialized for us. But it's such a different experience to have the book smarts, but then
Mhm.
to go out there and do it, and to do it simultaneously is really
Mhm.
unique. That you were able to do both
Mhm.
is fantastic to live out your educational experiences.
Yeah.
I actually did the same thing
Yeah.
when I was doing my master's, and it was tricky at times. Don't get me wrong, but for people who are considering a career in this,
Mhm.
it really does. I think it gave you. We'll talk about where this led to in terms of your career, but it gave you a
Mhm.
leg up, in
Yeah.
terms of advancement in your career too,
Absolutely.
because you really consumed and digested the
Mhm.
information, in terms of
Mhm.
its application rather than,
Mhm.
the book smarts are important, but it
Yeah.
was it was the two for you that was a
Yes.
game changer.
Absolutely. It was the combination. I think if I had just worked or just been in school, it wouldn't have clicked as much or it wouldn't have made as much of a meaningful difference in my life. But
Mm-hmm.
I love examples and I
Mm-hmm.
love being able to like think about when you tell me something, I love being able to connect it to my life
Yeah.
and connect the pieces, and that's what really helped me in school was being able to come to work or even to ask other people like, hey, have you heard of this, like, do you know what this means, or
Mm-hmm.
like, have we ever done something like this at our center? And that was, I think, really important for me. Yeah.
That's great. So, was there a moment in school? Do you have any moments that stick out or memories where you say, "Oh, like I remember learning this and then doing this"? I'll give you an example of something for me.
Sure.
When I was in my master's, I remember, we had some children that we were working with back in the day, and we continue to do so, that had some serious, challenging behaviors that put
Mm-hmm.
themselves at risk.
Mm-hmm.
And way back in the day when prior to my schooling, I had been a part of some, very positive procedures that really focused on reduction of the
Mm-hmm.
child, because we didn't want to like, have children at risk in any way.
Right.
But one thing that we didn't ever look at was the function. This is like early days, okay, back in
Mm-hmm.
the day. It was much more just like, here's a challenge, apply this technique, because we got to reduce, of course, we got to reduce the challenging
Mm-hmm.
behavior. So we're going to look at like reinforcing the absence. Just for example, we would do
Right.
like reinforcing the absence of the challenge. Okay,
Mm-hmm.
so that's great. In theory, that sounds good. But now I go to school and realize, oh no, if you don't understand the function or the reason, like the root
Mm-hmm.
cause, you're
Mm-hmm.
just like throwing darts at a dartboard and you're doing it blindfolded. Like you
Yep.
may or may not connect. And I remember sitting in class and I actually had Dr. Jim Carr, who is, now the CEO of the board, a wonderful, wonderful professor,
Mm-hmm.
teaching us about functional assessments, functional
Mm-hmm.
analysis, and why you need to understand the cause or the
Yeah.
root or the function, and going, oh my goodness, like I had no idea that
Yeah.
we needed to do this. And like the next day coming back to work and saying, guys, like there's this thing called functional assessment and we need to do this. This is for like every child that we work with. It's
Mhm.
super important and we'll get supervision on how to do it. And anyways, that was a major impact in my life. I remember reading the articles, going to class and realizing, ooh, okay, we got to take this to another level.
Mhm.
Did you have any moments like that in school where you thought like you learned something and then its application really changed your view or way of helping kids?
I think I actually had something kind of the opposite where I was at Breakthrough and they were telling me about high Ps, like just mastered tasks that a child knows how to do already, like clap
Yes.
your hands, touch your head, something simple just to, get the momentum and, they're learning something hard. You want them to get there. You do a bunch of easy tasks, right?
Mhm.
I learned that at Breakthrough. And then probably a couple weeks later, I learned it at school. I was like, I already know this.
Yeah.
That's great. Like I felt like I was so smart already. But again, yeah, like it really went hand in hand. I think probably everything I learned either at school or at Breakthrough and then connected them. Like it went both ways for everything. And
Amazing.
even toilet training too. I remember learning about toilet training at school and being like, what is it? Like, what do you mean? Like I didn't understand. And
Mhm.
then I was toilet training a kid and I was like, I get it now. I get it. Like it really
Yeah.
helps to do it for you to understand like the hows and the whys. You
Yes.
need to do it.
Absolutely. I love your example of the high Ps, or we call them high probability
Yeah.
requests. Fancy name for just like getting that momentum. It's
Yeah.
it's a good technique. Again, for some kids, we talked
Yeah.
about the need for customization,
Yes.
but it's a great technique to get kids successful, right? You ask them to do a bunch of stuff that they're really good at. They
Yep.
meet success, and then we're going to add in something that's a little trickier.
Mhm.
To do that in application and
Mhm.
then to like read about it and go, okay, wow, like we're doing
Mhm.
that's super cool. Yay for us that we,
Yeah.
we stay on top of relevant techniques.
Mhm.
But also this is a plug for people who are thinking about this as a career, or
Mhm.
even families who are looking for people to help support their child's learning in terms of treatment.
Yeah.
The two are equally important. The
Absolutely.
application and the understanding of the conceptual piece behind why.
Yeah.
So that what happened there is not just that, okay, we just do this stuff willy-nilly or randomly, that there's actually like a good reason or rationale behind the scenes, right? That
Yes.
is based on science.
Yes.
There's actually a good likelihood that these things will work under certain circumstances. So to tie those two things together,
Yeah.
to say it's not just, again, we're not just throwing darts at a dartboard blindly,
Mhm.
to use that example, but that we are very mindful of being very precise of we're going for that spot,
Mhm.
we're aiming for that, and we know how to get there
Yes.
is really what every child deserves in
Absolutely.
treatment
Yeah.
in ABA. And that's our job, is to
Mhm.
make sure that what we do is conceptually and scientifically sound
Mhm.
so that we can ensure that kids meet success.
Yeah.
And if kids deserve that, families deserve that.
Mhm.
So for you to do both together is such an amazing thing for your career, but it's also for the kids too.
Yes,
You know?
absolutely. I think if you're looking for services and you hire BCABA or somebody who has lots of knowledge and they're book smart, but they've never practiced it, they might actually have no idea what they're doing.
Yes.
Right? Versus somebody who has the book smart, but has spent, years being an instructor, years being a supervisor, years trying out all the strategies, testing out different things, doing functional analysis. And now they're here
Hmm.
and they can actually help you. They know what may work, they know what might not, but they know where to start. They know places that you could go, and it's just better I think overall for the families, for the kids. You need to put your trust in somebody
Yes.
that has experience but also knows what they're talking about, right? You can't just have somebody that thinks they know what they're talking about, but they need to have the practical experience as well.
Absolutely.
Yeah.
And your journey that's part of the reason why I wanted you to be on the show and share your experiences is a wonderful example of this where you have your schooling, you
Mhm.
have your practical experience, and that led to ultimately and mentored experience
Mhm.
that led ultimately to being able to be in a position where you can act in a supervisory role,
Mhm.
again under the guidance and mentorship as you develop your skills. But all that is really, I believe, your story is what families deserve in
Mhm.
services, right? It is that
Mhm.
commitment to being the best we can all be professionally
Yes.
under and working within the scope, the boundaries and expertise that we can,
Mhm.
working within a team. And it takes time to get there.
Yes.
And it's good for professionals to hear it too, that
Mhm.
there's a path to getting there. So
Mhm.
here you are, you're in school, you've got some application stuff, you're living it out in terms of your professional employment.
Mhm.
And then you also get certified as a registered behavior technician or
Mhm.
RBT. So, what led to that? What made you decide, okay, I think I'm going to pursue this certification? And how did you do it?
I think I was at Breakthrough for about a year, and I was like, "Okay, well, I really like what I'm doing. I like what I'm learning." I was just very busy. I think I would have done it a little bit earlier had I not been so busy handling both, but
Yes, fair enough.
I mean, yeah, like life is busy,
Yeah.
but it got to that point where I was like, "No, I need to invest more in this. Like I know this is what I want to do for the rest of my life.
Mhm.
I'm going to invest the time into completing this, getting certified." Because I knew eventually, like, I would want to become a BCABA, become a BCBA. Like, I knew this is where I was gonna go. So I thought, we'll start small. I'll become an RBT. I'll get the certification so that I know at least how the process goes. You need your coursework, you need to do the competency test, you need to write the exam. And so I just thought, I'll just do this and it'll be like a stepping stone. So that when I was ready to do the next one, I was like, okay, I've done an exam already. I've done some like in-person work, I've done some coursework, and I had that experience. So that was honestly, it was just I knew I was going to get more certifications and just like really invest more into my career, into what I know. But I thought it would be good just to start small and, like this is what I can do now
Yes.
to help further my career and to help really further all my knowledge. And it was very helpful to do the certification. And then even though I'm working on other things too,
Yeah.
I think it was really good just to do it and to really get into behavior analysis in other ways and to get certified.
Amazing. So, this, for people who don't know that may be watching, the RBT is the frontline
Yeah.
certification that people can, in Ontario, where we practice, it is not a requirement to
Mhm.
be an RBT. In some other jurisdictions, it is. But certainly, it's a certification that demonstrates some standards and certain competencies. And sometimes I call them
Absolutely.
like minimum standards because
Mhm.
it's not all the end all and be all. We recognize that in terms of how people practice. And it does require ongoing supervision, which I also think is
Yeah.
a good strength of it
Mhm.
because it helps people grow their skills.
Mhm.
But it certainly provides an acknowledgement of these are some
Mhm.
competencies that you've hit. Now,
Mhm.
again, you got to work to get there,
Yeah.
as you mentioned. And it's also for families out there to know that there are certain minimum standards in
Absolutely.
certain positions. So whether it's the instructor level or that frontline level,
Mhm.
and then we'll talk about there's some for the supervisory positions that are super important for families to be
Mhm.
aware of because it provides some type of standard measure
Mhm.
that people have in terms of the demonstration of their skills.
Yeah.
And I can't imagine for families, it must be super hard for them to navigate this world without
Mhm.
that. How do they know who's
Yeah.
qualified, who's not qualified? Again, in terms of minimum standards, it's not all the
Mhm.
end all and be all, but at least it provides a benchmark for families.
Yes.
So,
Yes.
but there is requirements to get there.
Mhm.
And even beyond that, and I know you're working on your board certified assistant level behavior analyst,
Yeah.
BCABA
Mhm.
level certification, which enables supervision.
Mhm.
These are steps that require a lot of effort,
Yes.
investment on your part, learning further learnings, further
Mhm.
mentorship. Emily, why do it? Why did you decide to do this? What drove you to embark on the certification journey?
I wanted that certification. I wanted to be that person that you can trust, that has met these standards. That's what I really want. Like, I want to be able to help families. And
Mhm.
in my eyes, I see, being certified as they can trust you. You're that
Mhm.
person that has this knowledge. I really, again, I want to further my knowledge. I want to further my career. I, I really just, yeah, it's like about working up the ranks and just getting more knowledge. And that, I guess that was the main driving factor was just, I want to be the best that I can
Yeah.
be so that I can be the best for the families
Yeah.
and for the children and for everybody that we serve that, yeah, I'm there and you can trust me and we can work on things together.
Amazing. What does that mean to you to be able to do that for families at the end of the day? You
It's
know?
so special,
Yeah.
so rewarding. It's really great. There's been some times that a kid has done something that they've never done before and I've nearly cried. That I feel like such emotion and I've told the families and I am nearly in tears. 'Cause I'm like, can you believe it? They did this today. This is the first time ever. And these families are so happy. Sometimes it's something as simple as zipping up your vest, right? Or putting on your shirt, eating your food independently, like
Yeah.
little things that we really take for granted that can mean so much. That gives you so much independence. Being able to say, I need to use the washroom and going and using it independently, what a great skill that you will need for the rest of your life. And how great is it that we are able to be part of that and to teach these life changing skills to children? That's so special.
Absolutely. And to be a part of that, it's a remarkable
Yeah.
experience to have. That was the
Mhm.
hook for me too. It was like,
Yeah.
wow, I use this thing called ABA. It sounds so technical, and it is scientific and technical, and all that
Mhm.
is very important for people to understand. We've talked about that. But at the end of the day, it's like you use this to make a direct impact on a child's life and the family's life. Is like, what better career than that?
Yeah.
Like, how blessed are we to be able to do
Mhm.
that, to go to
Mhm.
work every day and knowingly, really make an impact on that child's life for the
Mhm.
rest of their life is just a beautiful thing. And you do that through the hard work, the
Mhm.
educational
Yeah.
pieces, credentialing, all those
Mhm.
things lead to that meaningful change in that child's life.
Absolutely.
Any experiences that stick out to you where you said, like, wow, like this here,
Mhm.
this thing, like I was part of that.
I think my favorite example was probably we had a client we've been working on like putting on a vest, zipping it up for years, for a long, long
Mhm.
time. First time that this client ever did that on their own, I think I did shed a tear. I
Yes.
genuinely felt so happy for them, and then when I told the family, it was, like, even more exciting of, like, "Can you believe that they did this today?"
Mhm.
And to share in that excitement and to know, like, "You're able to zip up your vest now. That's great. What else can you do with a zipper now, right?
Mhm.
You can zip up your lunch bag, you can unzip your backpack to take stuff out, you can zip up your jacket, and your pants zipper and so many other things. Like it really plays a big difference, but we don't realize that.
Yeah.
And the family was so happy, like, okay, well, that's one less thing that they have to do for this child now,
Yeah.
right?
Absolutely.
They'll put on their jacket by themselves and zip it up and be ready to go. And that one was that sticks out to me. And that was probably a couple of years ago now too.
Mhm.
And I think about it and I get
Yeah.
chills because it was a really, really great moment for me and for them as well.
Amazing. And for people watching to appreciate that, we do, I say this too sometimes, and you had mentioned like simple as, we
Mhm.
think just in everyday life, we take these things for granted to
We
some
do.
degree in terms of what children are able to do.
Mhm.
So kids, at some point just they have to learn too, but they
Yeah.
pick it up from the natural environment how to zip up, or
Mhm.
they pick it up from the natural environment how to use a spoon and put it to their
Yeah.
mouth, or whatever that might look like for that
Yes.
child. But for some of the kids that we work with, that can represent thousands and thousands of learning trials
Mhm.
and of some very technical work
Mhm.
that is considered
Mhm.
and revised, and we take
Yep.
data, and there's all these technical pieces. But
Yes.
why do we do that all? It's to make a meaningful difference in a child's life and that
Exactly.
family's life. So that zipper, although to the average person out there and people who might
Mhm.
be watching might think, that's just like, the zipper. Yeah,
Yeah.
okay. But for that child, that is the difference between them being able to do something on their own, being
Mhm.
empowered, being on the path to
Mhm.
independence, having dignity, right? Being proud of something, being able to do stuff and
Yeah.
not, right? For
Mhm.
for lack of that experience.
Mhm.
That's a wonderful example. And that's really what
Yeah.
it is about for the family too, is to know, okay,
Yeah.
my child is on a path to growing up, living as independent of a life as they can.
Yeah.
Some of our clients may continue to require support and
Mhm.
care, even post treatment,
Mhm.
but that level decreases
Mhm.
like exponentially
Yep.
for kids when they get
Absolutely.
ABA.
Yeah.
The zipper is like a wonderful example. And then it's, yeah, okay, what else can we do with the zipper? We got to do the lunchbox. We got to do this. We got to do that. How amazing
Mhm.
is that? That is such a good
Incredible.
example.
Yeah. It's a
Yeah.
wonderful feeling. It
Yeah.
really is.
And to know that you're part of that.
Yes.
Yeah, that's it. Like, you have that for the rest of your life. Like, you made that impact on that
Mhm.
child's life and on that family's life.
Yeah.
Again, we're so blessed to be in that,
Mhm.
in this career, in that example, and in many of the things that you do on a day-to-day basis. And I know this firsthand because I see you. You
Mhm.
come to work, you have a smile on your face, you help your team, you train people on the
Mhm.
team by virtue of, your work learning supervisory positions.
Mhm.
You work with families, you do parent coaching, so many dynamic aspects to your job.
Yeah.
There are challenges with the job too,
Yeah.
even the number of learning trials, go back to the vest example and the zipper,
Mhm.
that takes time to get there.
Yeah.
And then there are some kids who exhibit, things that may harm themselves, could
Yes.
harm others. So for people out there that are watching that, maybe in the field or considering the field,
Mhm.
they would want to know, Emily, like, how do you keep doing this? What keeps you going to get in every day? How do you have that smile on your face every day, Emily? Because I see it and it's remarkable. But I know the hard work is real too. So what keeps you going?
I think the main thing is knowing that for every hard day or bad day, there's 5 or 10 good ones. It's not always bad. The bad seems to overshadow, like, it overtakes the good, but it's easier to remember the bad days than it is the good, but truthfully, it is those good moments that happen a lot more often than we realize,
Yeah.
right? It's one bad moment can overtake 10 good ones. And I think the important thing to remember is that even when it is a hard day, the kids are still learning, right?
Yeah.
Something might be hard for them and they might, they are trying to zip up their zipper and they can't, and maybe they cry,
Mhm.
right? But still, it's practicing and it's us teaching them through learning, all like lots and lots of trials,
Mhm.
that they can do this. And it might take a while sometimes, or some children might have challenging behavior when it comes to doing certain things, or, like we said, the functions. So obviously the functions are different, but at the end of the day, the good is better than the bad. The good, there is more good than the bad or the
Yeah.
hard. And that's what keeps me going, is remembering all those great moments that I can share with the families, and just knowing the impact and watching the children grow up and see what
Mhm.
incredible people some of them have become, right?
That's wonderful. Wonderful perspective.
Mhm.
And I really like just to highlight to people that are watching that you mentioned that some of these challenges are a part of the learning,
Mhm.
right? And we do everything, yourself and the entire team. I see this all the time. Everything to increase the success, the
Yes.
probability of success. We break things down into small
Mhm.
pieces. We think about things that are meaningful. We're not going to just do things that are arbitrary.
Yeah.
We talk to the family, and
Mhm.
it's in cases where kids are able to also vocalize what matters to them. We
Mhm.
ask them, or even not vocalize, doesn't matter if they can
Mhm.
express it. We look for things that matter to them too, for their
Mhm.
families. All of these different pieces are a part of a play of treatment.
Yes.
But of course, because we're teaching new things, just like in any educational
Yeah.
setting, some things are going to be a little tough. It's a necessary part of it. The fact that you mentioned that, I think, is really important for people to
Mhm.
think about. And if not for us, who, right?
Yeah.
Families that we work with, kids that we work with, they are experiencing this stuff in everyday life, and likely to a much greater magnitude from a lot of
Mhm.
the things that we hear from families, right? So if we're not helping them, who's helping them to overcome?
Mhm.
And for you to have experiences that it's possible, it's optimistic, that you
Mhm.
can overcome it. It's so
Mhm.
important for people to hang on for that, hang
Yes.
on to that. And especially people who are in the field or considering the field, like that's what makes it
Mhm.
all worth it.
Yeah.
Absolutely. You shared successes and what makes it worth it with the kids.
Mhm.
I know you also work really closely with the families, which
Mhm.
is such an important aspect to all of this
Mhm.
and what we do in terms of ABA. Successes that you've had with families.
With families, there's a lot. The
Mhm,
families, I find, children aren't always able to tell you thank you for teaching,
mhm,
but families are. And you can hear sometimes they tell you the stories of, we were able to eat dinner as a family together because I didn't have to feed my child. Right. And that's so special to hear that. Right. Or, we're working on toilet training, and my child can ask now to go to the bathroom on their own. Like, what a meaningful thing. Like, they don't have to wear diapers anymore. And for me, like, hearing that from my families really, like, it makes my day. Sometimes it makes my
mhm,
week. Sometimes it
mhm.
makes the month, right? Like,
Yeah.
the highlight of it is, hearing from them or getting an email saying, my kid did this. Like, that is so special because, again, like, the kids can't always say it. Like, I know they're grateful for learning, but the families are the ones that tell us what a difference that it makes in their life. And that's what I think is so incredible about this field, and about
Yeah.
working with these kids.
Amazing. Having those experiences, it's, you don't, when you're in school, for people those of us that have experienced it, and for those of us that have not, we can share that you learn a lot through the textbooks. We talked
Yeah.
to that's very important.
Yep.
A lot of the technical knowledge. What you don't necessarily always get to learn, and hopefully this will change. It's one of my passions. Certainly is, those skills that it takes to engage families in the process. We've highlighted throughout our talk today that working with the families is key. This is instrumental
Yep.
to everything we do. So we know that this is important.
Mm-hmm.
But how to get there, right? Every family is on their own journey, has their own unique experiences. And we do too. I always say, like, we come in with the ABA expertise, right?
Mhm.
That's what we come in with. They come in with the expertise of their child, their
Mhm.
lives, their, experiences. And it's the two, ultimately, they get married together that leads to best child outcomes. But yet we're not so good at figuring out how to do that in school, or we haven't really defined, like, how does this exactly work, even though we all agree that this is super duper important for children to be successful, for families to be successful.
Yeah.
You've had a lot of successful experiences with families. How did that work? What were some of the key ingredients that you think made all of that possible?
I think the biggest thing is being able to listen to them, to hear what they really need, right? If they're telling me, I want my child to use a spoon and I want them to eat independently, we have to teach them using what they know. Like if the family says I want them to eat using a spoon, I'm not going to feed them yogurt if they don't like yogurt,
Mm-hmm.
right? We have to use things that the kid likes. So I find listening is a huge one for families. Like if they don't feel like I'm listening to them, they're not going to want to listen to me for what I say.
Mm-hmm.
Collaboration is huge too. And I find it's not always, I can't tell them what to do, right? We can't tell them. It's what can you do in this moment? Like, how can I best support you? And how can we work together to solve, the problem or to teach this skill or to do whatever it is we need to do? That's the biggest thing too, is really how can we work together? It's not one-sided. It's not, you're not on your own.
Mm-hmm.
And that's why I always tell them, like, you're never on your own. You can always ask for support, but it's not going to be just me telling you what to do or telling you how to live your life. It's a collaboration of the both. And you tell me how you live your life, and I'll tell you, some strategies that could help you right at home. And there's been times where I've been like on a video call or on a phone call with a family in a moment, like kids brushing their teeth. And I'm, okay, next time, like, I'm on the phone, like, okay, next time do this. Or on a video call, okay, next time maybe don't do that. Or, here's a strategy. And it works. Even if I'm not there in the moment, like
Mm-hmm.
physically, it's sometimes being able to just give them a little tip or trick that isn't overpowering their life or,
Mm-hmm.
taking over, but it's still so helpful
Yeah.
to them. And I've had families too that have come back from that and said, your 30 minutes of you being on the phone with me when my kid was having a shower or doing whatever was so helpful because you were able to give me that one tip and it made the biggest difference. And now they're able to have a shower independently. Right.
Amazing.
Yeah.
Amazing. There's so many key things that you said there, but some of the things
Hmm.
to pull out. I think it's important for practitioners, but also families to hear,
Hmm.
in terms of getting to the point where you have that best, what I call parent professional partnership, right? It's the listening,
Hmm.
absolutely collaboration. And
Hmm.
then there's some flexibility there in terms
Yeah.
of responsiveness
Hmm.
to families knowing that you're going to be there to support them and we're going to work through it,
Yeah.
right? And if you adapt those skills, then
Hmm.
the kids, ultimately the kids are going to learn the things they need to learn. We are taught so many wonderful strategies, and we
Hmm.
learn through the books about so many things that are effective. We see it. We look
Hmm.
at data. We're really into our data, which is great. It's a very objective way of measuring success.
Yes.
But none of that matters unless we're working on things that are meaningful and applicable to families.
Yes.
And that your experiences with
Mhm.
families, being on the phone, you
Yeah.
know, look, you've got to be flexible if you're trying to figure out how to help a child learn how to
Mhm.
shower. We're not going
Mhm.
to be there in that moment
Yeah.
helping that child,
Mhm.
but yet this is a key skill
Yes.
for that child to learn. And so you figure out ways. And if it's being on
Mhm.
the phone or whatever that looks like for that
Mhm.
family, knowing that they have your support,
Yeah.
on something that matters.
Yes.
This is really to get to, like, to really dig deep here. These are things that we're not yet learning in school. We're not
Mhm.
yet learning uniformly throughout the field,
Mhm.
but yet this makes all the difference. So
Absolutely.
now you have
It
kids who
does.
can take a shower by themselves. Like, this
Yes.
is huge,
Yeah.
huge for that child.
Yeah. What
Yeah.
an important step to independent living, right? And that's our goal for a lot of our kids is, what can they do independently? How can we help them get there?
Hmm.
And it is a partnership. And not even just that, but like with schools or with other caregivers, daycares, whoever else might
Hmm.
be. That's what we're here for, is to really just support your whole life and to help you in any way we can.
Absolutely. Yeah. We're helping them to basically spread their wings and fly,
Yeah.
right? We're not going to be there forever. We're there to help support
Mhm.
to the next step
Yeah.
in terms of wherever their life takes them. And to
Mhm.
get there, you have to really key into meaningful things that matter
Yeah.
to that family and to that child. So amazing experiences that you've had with parents in terms of working collaboratively with them. You do the same with a team. You do the same thing with
Mhm.
your staff that you've worked so wonderfully with. For them, in terms of their learning and training,
Mhm.
what are some of the most important things that you think is important to help staff with early on? Again, all of this is about making a meaningful difference in that
Mhm.
child's life. So what have you learned through your experiences with working with staff and training them, while also working with families and the kids and all those other pieces?
Mhm. I think in the beginning, when staff are new or when they're still learning, feedback is huge, right? And when I say feedback, I don't mean negative.
Mhm.
I mean both, like positive feedback and constructive, right? That's how
Mhm.
we all learn, is you do something and it's, love how you did this. Great job doing this. Keep doing that. We have to give them that reinforcement, right?
Yeah.
It's the same with when we teach the kids, when we're teaching staff, we're also reinforcing them, right? That's how they will learn, is through that reinforcement. But then we also give them those constructive, you know, pieces of feedback that, you did great with this, but next time, try doing it this way. Or I
Mhm.
encourage you to, approach things from a different angle. And I find that is really important, especially in the beginning when they're still learning. A lot of people are very unsure
Yeah.
and they're not, they're hesitant to do stuff, or they really just don't want to. But having that feedback piece is so important, and telling them, I know you don't feel confident yet, but you're doing a great job. Like, you're trying your
Mhm.
best, you're doing all these things, but like in the end of it, feedback for anybody, right? Like kids, staff, anybody. Feedback is huge.
Yes.
Big part of what we do as well, and training and having staff. And I think it really leads to a lot of their success, and is one of the things that I remember,
Mhm.
like when I was being trained, was getting those pieces of feedback and getting, when people were constantly reinforcing me or saying, that was great. Let's just try to like slightly different next time.
Yeah.
And it doesn't feel, like they're coming at you. You're like, you're horrible. You're a terrible instructor.
Mhm.
It's more just like, you're doing great,
Yeah.
but like we can always strive to be better. And, there's little things here and there that we can work on and change slightly. But overall, you know, you are a good person, you're trying your best, you're doing your job, and we're gonna help you get even better.
Yeah, if anything, they're toughest on themselves
Yes.
more so than anything. And to be there to offer that coaching and the support for
Mhm.
staff too can be a game changer. Having experienced it yourself as a frontline
Mhm.
staff, me too. That's how I started
Yep.
back in the day, frontline, and had all these different experiences.
Mhm.
What would you want instructors to know? Having looking back, like what are some of the things that you say?
Mhm.
Like, this is what matters. What matters at the end of the day for staff? What should we all be focused on in terms of helping
Yeah.
kids, live their best lives?
In the beginning, I think it seems a little overwhelming, like, especially if you don't have a background in ABA or you're
Mhm.
not sure. There's a lot of terms, there's a lot of
Mhm.
abbreviations, there's a lot of lingo that we don't even know. There's all these different procedures and just everything. But the thing is, like, remember that it does get easier. I find
Mhm.
with everything, like any job that you have, really, like the first few weeks are tough. It's a new environment, it's new people, it's new things that you're doing, and it's hard. It gets easier.
Mhm.
That's the best thing. Everything gets easier.
Yeah.
But I think it's really important to remember that you are making that difference in somebody's life, even
Yes.
a coworker. Maybe it's not even the kid you're working with,
Yeah.
but it could be your coworker,
Yes.
it could be, like, the parent, it could be somebody else, right? Like, you are making a difference, you're here to make a difference in kids' lives, but in the grand scheme of things, like, we're all here to better each other and to improve our lives and, you know, to have a good day too. So I think that's really important for staff to remember when they first join a new team or start ABA or, become
Hmm.
instructors, like, you're going to be fine.
Hmm.
I promise. And things will get better and you're making a difference. Even if you
Yes.
don't think you are,
Yeah.
you are.
Keep it in perspective, right?
Mhm.
Why are we here? The why. Why are we
Mhm.
here? What are we doing here? That's also important in terms of success for the kids, right? That we don't get lost in the trees of it all,
Yeah.
we can't see the forest from the trees kind of thing
Mhm.
because we're so worried about whoops, I didn't deliver my reinforcement fast enough or
Yeah.
whatever. So of course we're going to be there to help shape all those skills
Yes.
and have you be the best instructor you can be. But
Mhm.
look what you just did. He just reached for that item a little faster than he did the last time or
Mhm.
whatever that might mean. And why does that matter?
Yeah.
Because that is his spoon that will allow him to feed himself so that he
Mhm.
can live an independent life, right? Like,
Yes.
what's the perspective here?
Yeah.
Why are we all doing
Mhm.
this? And I think that's really important to keep in mind. It also helps with, some days that, we might have to practice something more often, or we
Yeah.
might have to work through some challenges that put a child at risk or put other people at
Mhm.
risk. It's to say, that's why they're here.
Mhm.
We're here to work through that stuff and
Mhm.
it keeps us going. So it's amazing to have people like yourself there to support staff through
Yeah.
that and to take it like one level even further. So we have staff who are, if they're early in their careers, figuring
Mhm.
out how to best help the kids that we
Mhm.
work with. But, from a family perspective, if we take it even, more broadly, families are looking for people like yourself,
Mhm.
professionals who are in positions to make a difference
Mhm.
in their child's life, right? And there is a lot of information out there. There's a
Yeah.
lot of stuff out there for families
Mhm.
that can make it incredibly difficult for them to navigate and to
Mhm.
know what is even like a quality provider. What should I even look
Mhm.
for? And so
Mhm.
you've had all these wonderful experiences, even starting from your neighbor and saying, hey, you know what? I think he can learn things, to going to school, to practicing it all. So you've had these experiences to demonstrate A, we should think differently. And then B, when we think differently and we use the right treatment, the right
Mhm.
skills, have the right professionals, wonderful things can happen for
Mhm.
children and their families. So imagine a family's here today and they
Mhm.
want to know Emily, or, there's people here listening, I'm sure, they want to know, what do I look for? How do
Mhm.
I get to that point where my child can live their best life?
Mhm.
Based on your experiences, what advice would you have for families? What should they look for in a provider?
I think again, I think I have probably mentioned this, but I think it's important that you look for somebody who listens to you,
Mhm.
who doesn't just brush off your concerns or what you want, somebody who is willing to collaborate with you again. And it is part of that listening that they're listening to what you're saying, they're taking into consideration your family, your beliefs, your religion, your customs, like just who you are as a family and how we can best help you.
Mhm.
Somebody who's willing to train you or to teach you how to help your child, right? It's not, me as a service provider. I can't be the only one making a difference, right? Like I see the kid for a couple hours a day, right? You're with the kid for the rest of their life,
Yes.
the rest of the day, the rest of the week. And you need to also have some of those strategies, or you need to know, how do I teach my kid how to eat? How do I teach them how to put on their shirt? And that's what we're here for too, is that support outside of when they're at our center. I think they just need to look for somebody who is compassionate, who is kind, and, if you don't feel comfortable with them, like if you're always thinking, I don't think this person listens to me. I just
Mhm.
don't think the way they're talking to me is nice. Like they always brush off my concerns. They're not addressing my concerns. Like that's important as a family is
Yeah.
you're looking for that kind of stuff. They may not know about the certifications or about different things that you can get, or I don't know, the difference between like ABA, SLPs, OTs, like all these different professionals, but they know what matters is those core values of like being kind, being listening, willing to collaborate, supportive, like those things.
Yes.
And then, then we can get into, what makes like a good ABA therapist or BCBA or somebody else, like having somebody on, that is registered, right?
Yes.
Versus just some person who's like, I practice ABA,
Yeah.
I know what I'm doing, versus somebody who has gone through the schooling, has gone through the experience, has gone through the certification process. And so that's harder for families to understand though, but it is really the core values that matter to families.
Mhm.
That's what they know, right? We can talk all this jargon about, different professionals and what makes them good or bad, but it really is like who you are, not even as professional, but just
Mhm.
as a person, right? And I think that's why people come to breakthrough is, we do listen, we're supportive, we are willing to collaborate, and we're like compassionate, right?
Mhm. Amazing. That's an
Yeah.
amazing summary
Mhm.
of some of the key pieces that really do lead to
Yeah.
kids' successes. So, luckily, we're at the stage in the field and for the community
Mhm.
that the technical pieces, as you mentioned, can be hard for families to sift through.
Mhm.
What makes somebody have technical expertise? Well, now we have certification in some
Mhm.
professions like SLPs, OTs, there's professional regulation in Ontario. We'll have professional regulation soon for the
Mhm.
supervisors of ABA programs, which will
Mhm.
be wonderful.
Yeah.
In other places, if people watching, across the world in other jurisdictions, there's things called licensure
Mhm.
for behavior analysts. So that helps at least sift through
Mhm. Yes.
minimum standards for technical expertise.
Mhm.
So this is important. There has to be some kind of level of technical
Mhm.
expertise that people have, because without that, what are you practicing? We
Yeah.
don't even know what you're doing. But at least that says, okay, somebody else, some big board or regulation, you know, committee or whatever that college may look like,
Mhm.
has said, yes, these people meet some minimum standards. So that's
Mhm.
important. But the other piece that you spoke mostly about, which I think is
Mhm.
equally, one is not exclusive of the other for
Mhm.
families to look for, so important, is those values, to be able to
Mhm.
share the common
Mhm.
values, know that what matters to you and your family will be integrated
Mhm.
into programming. And I also, from my experiences, feel the same as you in terms of, like, families have a gut about this,
Yeah.
right? Sort of an instinct, a gut check to
Mhm.
say, okay, like, is this a team that I can work with?
Mhm.
And that demonstration of the compassion, the listening, all those pieces intersects in that, understanding some of the cultural pieces that will be important to that
Yeah.
family, so much so that those things are so important that our ethics code that just recently evolved, and we have a new edition, has incorporated all of this
Mhm.
into it. So behavior analysts, in fact, now are held to a standard
Mhm.
of compassion, of certain cultural competencies that we need to do our best to ascribe to. So this is something that our field is moving towards, and it is so important. I'm so happy to see that, because as you've pointed out, all those pieces lead to a child's success. And that's really what this is all about. It's about
Mhm.
achieving, in our case, because we work with kids with autism,
Mhm.
we want to see those kids succeed.
Mhm.
You cannot do that without the family being involved.
Mhm.
They must be a part of the team. That's
Yes.
it. That's all they
Yes.
have to be. So, looking back, highlights that you've had in terms
Mhm.
of working with the family. We've talked about highlights for the kids,
Mhm.
things that have mattered for instructors. For the families, what are a highlight that you've had, seeing that? Or even you talked about collaboration too with other
Mhm.
professionals,
Mhm.
which also matters as well. Any collaborative highlights that you can share?
Yeah, I have a good list of examples of these, but I've been to daycares for some of our clients, and I think that was a huge one was working with a client who's toilet training. And we were seeing some good successes at our center, seeing some good successes at our home, but at their home, but there was something missing at the kids' daycare. And so went in, gave them some tips, and then we were seeing successes. Like we were seeing the child was asking to go to the washroom at the daycare, and it's busier. It's a busier environment at a daycare. There's all these little bodies running around,
Mm-hmm.
but
Yeah.
being able to go in and give them a couple tips and a couple tricks, and encourage them, I think really played a huge difference in helping that child, right? Because we want our children to be successful, not only at our center, right? Not only at their home, but they're able to go to the community. They're able to go to daycare, to school, to swimming lessons, to summer camp, wherever, and to be able to do the same things, right? That's one of the things we talked about,
Yeah.
generalization and being able to do the same skill in different environments. And for me, that was really a huge success with collaboration was, we're working together. This is the team is me and the breakthrough team and the parents and the daycare. And that collaborative effort led to the success of this child's toilet training, right? And if we didn't have the buy-in from the daycare, like this child would not be doing as well as they're doing right now. So I think that's a huge one.
Amazing,
Yeah.
amazing success for that child and the family too.
Mhm.
That's meaningful to them to know that,
Absolutely.
okay, in all environments, my child can do the things that they're capable of doing,
Mhm.
right? As opposed to like learning it, at the center and then not seeing it anywhere else. I mean,
Mhm.
what's the use in that,
Yeah.
right? But that really took like a planned,
Mhm.
mindful approach of working through it in different environments. What that looks like in different environments can be so different that led to that success. So we've talked about, the key ingredients for success and
Mhm.
across families, professionals, the kids themselves, our
Mhm.
team, all super important. The flip side of that, for people to see the realness of the entire, spectrum of working within this field. There's so many different spectrums that we experience, not only the autism spectrum, but
Yeah.
the day-to-day things that we do with the
Mhm.
kids are some of the challenges that we've worked through. We've talked about what helps push us through the challenges and lead to the successes. Do you have any moments that you can share with people who are watching that, stood out for you of something that was particularly challenging that you worked through to showcase like, yes, we can get through this and it leads to meaningful outcomes? Anything that sticks out to you in your experiences?
I've worked with a number of clients that have had some challenging behavior, and I think the biggest thing for me is like when you're in it, it feels like it's going on forever, right? And it feels like it's never ending, and like the kid's unhappy, you might be unhappy too, and
Yeah.
it's a tough moment to be in. But I think it's working through that and being able to say like, okay, we're both okay at the end of this, right? We both made it out okay. We're smiling still at the end, and we're able to reestablish our relationship. Sometimes you feel when a child is engaging in challenging behavior, it feels like, okay, well, they don't like me anymore, or whatever the case may be. But that's what I
Yeah.
always remember is, like at the end of the day, we're still okay. And even though you had a hard time, maybe I had a hard time too, we worked through it together. Again, that's what it is. It's the collaboration, even between, you know, the kid and the staff, is we're working together. We're getting through this tough moment, and then we
Yeah.
can come out better on the other side. And that's happened a lot of times, but
Yeah.
and across a lot of different kids. But I think at the end of the day, like I know we're making a difference in their life, and it's okay to have a bad day too. And
Yeah.
at the end of the day, yeah, we're both in a good place. We're both able to overcome whatever that tough moment was and learn something from it.
Yeah. And that's part of the learning too.
Mm-hmm.
Again, we do everything we can
Hmm.
possibly to set up the experiences such that uh, we want to prevent any of that stuff from
Yeah.
happening. But sometimes we are working through tough stuff.
Hmm.
And it's things that the family and that individual is experiencing in everyday life too. And so it's necessary
Hmm.
to work through it, but to know, to share that
Hmm.
get through it, we're going to be okay. And in fact, we'll be better than okay afterwards
Yes.
because those are teachable moments to learn life changing, game changing skills
Yeah.
that make a difference to that child, that family,
Hmm.
and the community. So, we've talked about so many facets of ABA, and at the end of the day, how it's optimistic and how it can lead to life-changing success for the kids that we work with and their families.
Hmm.
What do you want families to take away from your experiences, from understanding ABA and the community at large? What would you want people to know about ABA?
I think I would want people to know that it works.
Hmm.
It's individualized, it's so important, and it really can help anybody. And if you don't think it can help you, what do you know? Like, you might as well just try. If you're thinking about starting in services, like, go, just do it. It's not about the commitment right away. It's about trying, just seeing if it will work, like trusting too. I think a
Mhm.
lot of people are a little reluctant to try something or
Yeah.
to start something new, but you know, we are here for you. We're here for the kids. We're here for the families. We want you to just try. Same for staff too.
Yeah.
If you're a person that is thinking about getting into the field, thinking about, you know, working as an instructor, doing ABA, like, apply,
Mhm.
try it. You might like it. You
Mhm.
might find a lot of joy in it. You might find a lot of great things that come from working with this population or in the field of ABA. And I just encourage people to just go for it. Just, put your foot in the door and try something new. Try
Yeah.
something that scares you, might scare you as a family or as a staff. And I think good things can come from it.
Absolutely, because it works.
Yep,
And at the end of the day, it offers hope and
it
optimism
does.
for your child to be able
Hmm.
to learn the things that they need to succeed in life. Right? It's
Hmm.
it's a wonderful solution
Hmm.
to some of the needs that your child may have. And for staff too, it works, and you can be a part of a game changer for that child's life. What a
Hmm.
beautiful thing to be a part of.
Hmm.
Thank you for sharing your stories of hope and optimism and your journey and how to get there. It's wonderful to hear. Appreciate you taking the time, Emily.
Yeah, thank you so much for having me.
Yay.